Well, oh,
So
I will.
maybe it's. I'll tell him to do that. You can get a hold of it again.
Right. Right. Because one house. What was different the last time you guys did this? Very selfless. It's really bad. It's hard to get into one site, seven, and one house. Right. Okay. And that's exactly what we're talking about.
Hey Taylor, can you hear us?
I can hear you. Good afternoon. And Madeline's here as well.
So, climate change actually is the unhealthiest for women. And then, and for men. So climate change is the most not the. Yeah.
What?
What?
What do you want?
I'm special, I get a cool book.
I guess.
You probably put them in. Ready. It's on? If we're ready, whatever. Okay, oh, is that time, isn't it? Yeah. I don't think anybody's here, we didn't have phone.
People
Right,
probably forgot about it. Nobody emailed to their mind.
yeah, I think that kind of happened. Let's go ahead and call this meeting in order. I got 2:02. Can we get a roll call?
Let's try that here.
Crap, I had lunch with the sheriff, I should have reminded him of.
It's in a week ago.
You didn't get any?
No, I emailed Nick. I never got anything back, but I emailed Fatima. I forgot about her. So
That should automatically come to me.
thank you, Will.
All right, Tony Mitchell. Absent. Bill Ibershoff.
Present.
Thank you. Cindy Potter.
Present.
Thank you. We'll skip the city attorney, and Fatma. Sheriff Jason Pollock. Absent. Jeff Hurd.
Okay.
Thank you. Michael Baker. Not here. Absent. Mayor Mike Lapine.
I'm present.
Thank you. Nicholas Sneed, that's me, I'm here. Penny Condomo.
Kadima.
Thank you, my apologies. Absent. Steve Webb.
He has an excused absence.
Yes, he does. We'll let the record reflect that for a while. Tim Gasner. Absent. Trent Titus.
Present.
Great, yeah, 1, 2, 3 voting members. The 9-member committee.
We do not have a quorum today. Okay,
We still do the presentation.
we can still do the presentation and talk about stuff. We just won't be able to vote on anything. So let's go ahead and move forward. Do we have any public comments? None? Okay, then we'll move on the homeless report update and recommendation. Is that you, Nick?
Yes. So this afternoon, we have Beacon Northwest to give us this report. Quick. I've asked them to give us a 10 to 15-minute report
Okay.
on the recommendations for the homelessness report. And so Taylor, if you'd like me to advance the slides, would you just please let me know?
Will do. And Madeline will be starting the presentation for us.
Great. Can you see the slides online? No?
I
No.
can't.
We can see them behind your head, but you can share them on the Zoom that would allow us to see what you're seeing.
Sorry, I'm having issues.
No problem.
Share the screen. I'll tell you what, we'll just go on to page, slide 2. I'll let you know what slide we're on. How's that?
Okay, that sounds fine. Thank you all. My name is Madeline Miller Barron. I am a senior project manager here at Echo Northwest, and together with Taylor, we've been working with Nick and the team to help generate the homelessness recommendations report on behalf of the city. We've presented to you all once before. I think it was back in June, maybe early June, earlier this summer. And so we are coming back to you today to present a status update on where we sit, what we've done this summer, and to also provide you with some of the initial findings that we have after completing some existing conditions work and stakeholder engagement this summer. And then more importantly, we'd like to solicit your feedback on the next steps forward. So we are at the point where we've drafted some potential recommendations to put forward in the recommendations report. We want to seek your feedback on those recommendations and also seek your feedback and input on the content that we're using to evaluate those recommendations. So we have a slide, and we'll get into it at the end of the presentation, but kind of some criteria we would be using to evaluate these, and just information we'd be providing to each of you and to the general public in the report that describes the actions and the recommendations and their kind of the details thereof. So that's the purpose of our presentation today. We have about 10 or 15 minutes of slides here, and I wanted to note that you received a really big slide deck from us on our packet, and that was not exactly intentional. We have 7 or 8 slides here, but you have a whole host of additional information with a lot more than what we're going to cover today. So if you do have that in front of you, either printed or on a computer, you can follow along, but we're certainly not going through the pages and pages of information in your packet. I believe our existing conditions memorandum, Nick, you can correct me if I'm wrong, but I believe it is on the project website, and we will be producing the report. The report will be published there as well. So That's why we're here today. Thank you for having us on your agenda. And I'll pass it to Taylor for the next couple of slides. I think, Nick, you can advance. Oh, Taylor, you're muted.
My apologies. Yeah, so like Madeline said, we're gonna keep this section short just because we've got the existing conditions report online. But I wanted to just cover some of this as a reminder of what we discussed in the existing conditions report. Basically, we've overviewed the population and housing market conditions in Madras to get a sense of what the population needs might be and you know what housing exists currently, what are the vacancy rates, etc. So when we looked at the population, we saw some population growth. Specifically, there's a 48% increase in the population over the time period that we examined. And we also saw.
Quick question for you. When you say time period examined, what was that time period?
Yep, sorry. That was going back to my report, 2010 to 2022. So it's a long time period. And if you want a shorter time period, we did also see an 8% increase in the population from 2020 to 2022. So just to give you a sense of that. And then we also looked at incomes in the population. In the city of Madras, the median household income is 52,000 in comparison to 71 in the county. So by that comparison, we felt that the median household income in Madras was a little bit lower. We also saw a higher degree of diversity in Madras than surrounding areas. In the city of Madras, you have a 10% population of American Indian and Alaskan Native, and then a 38% population of Latinx folks. And just comparing that to the state of Oregon, for example, there's only 1% population of American Indian, Alaskan Native, and 14% of Latinx. So that's not showing on the screen, but might be in your more detailed packet. When we took a look at the housing market, we noticed that there were more multifamily units needed. There's a pretty high percentage of single family housing. Now, Madras has produced a little bit more multifamily housing in recent years, and you'll see that in the detailed packet. But for the most part, like in the last couple of years, I want to say, there wasn't as much of a production of multifamily housing, and the overall percentage is still low and not enough to accommodate the number of people who need multifamily housing. We also saw a low vacancy rate. So looking at the underproduction count, there are 398 units that still need to be produced in order to accommodate people who need housing. And the vacancy rate in Madras is at 2% in comparison to 17% in the county and in the state. Yeah.
Okay, quick question is, Will, the city administrator, is it the recommendation that those 398 units be multifamily or single family, when you said number of units needed?
Madeline? It doesn't break down in that way. We did find that generally more multifamily units were needed to accommodate to help stem the increase in the increases in rents that have been seen. More supply will help with the need for affordable and available units. It will also help with the vacancy rate, but it's not to say that all 398 units would be needed for specifically for multifamily. These estimates, I believe, they come from the Oregon Housing Needs Analysis draft pilot, which is actually being updated at this moment and will provide new local results on housing need actually in a document that's being published later this week. And so these numbers are old and don't break down the unit type. The new ONA numbers won't either, but there is going to be new statewide guidance from the Department of Land Conservation and Development that will help cities identify the housing mix that could help their housing markets.
Okay, thank you.
Okay, so moving on to home sale and rent prices. That's, and was someone going to ask something?
No, I actually advanced the slide and I shouldn't have, I'm sorry.
Oh, okay.
So I
Looking
have
at
a
your,
question on that one, the multifamily asking rent and the home sales cost, is that from 2010 to 22 as well? Or is that a different time frame?
so the median home sales increase is from 2018 to 2024. And then the multifamily asking rent increase is over the last 10 years. So from 2014 to 2024, they're just different time periods because of the data availability. But those are the year increases there.
There's gonna be a lot of fluctuation in those years for those numbers, so it's kind of really hard to read what it's gonna be this next year compared to that.
Right, especially when you're, if this goes before the city council, we'll have to be very clear where the numbers come from. Because when you look at it, it's, just distinguish it fairly because it's not apples to apples, it's grapefruit to pomegranates.
Yeah, well, we can fix that and make a note about that. It's on, like, we were trying to keep these slides very simple for this shorter presentation. But we can definitely add those years on this slide just to add that additional information.
Yeah, because definitely towards the responses you're gonna get, because people would think that it's the same time.
And I bet the asking rent between 218 and 224, I bet that 62% is pretty close, because it's been huge. Few years.
Yeah.
I don't think it's 10 years.
And there
And then
is,
is the high cost burden, the 39% a snapshot of today or a snapshot of a different time frame?
The high cost burden is a snapshot of the latest available data, which when it's
2022 from
Yeah.
America, from the census, yeah. Sorry about that. We will make sure to put the years on the slides and the data sources. Thank you for that feedback.
Okay.
Yeah, so as we just discussed, there's a almost 40% high cost burden rate in Madras, and that includes both cost burden and severe cost burden. So I think all of this data put together, with an increasing population, more diversity, low incomes and rising rents, that all kind of does lead into that cost burden, and essentially typically points to needing more housing and especially affordable housing. And so that will show up somewhat in our actions. But we also based our actions on the engagement that we did. So Nick, if you can go to the next slide. And we can just go to where it says challenges and barriers. I just can't see what's on your screen right now.
Yeah, we're there.
Okay, perfect. So we discussed a number of things in our engagement. We covered housing topics and services, shelters, etc. Some of the main things that came up were under housing is that there was a lack of affordable housing. People discussed having long wait times for getting into supportive housing. A lot of times that might have something to do with landlords being, not as willing to participate due to some fears about ability to pay rent or damage to property. And so it can be hard to find people who are participating in the supportive housing program. It might also have to do with high security deposit requirements, which again relates to that fear about property damage. And strict rental criteria. So there might be people to participating in supportive housing who don't meet that criteria, and it can be difficult to get them in. When we discussed services and shelters, some people mentioned that there wasn't enough on the ground outreach to people who are unsheltered, and that more of that outreach might help get people connected to resources. They also discussed a mismatch between people's needs and what the shelters and services can provide. And so with that, you might have some people who are homeless who have, substance use addiction and can't fit into the shelter because there is a prohibition against using substances there. So they might need something a little bit more involved, a shelter that would allow a treatment program. Or you might have individuals who have a family and need a specific unit to accommodate their family, or people who prefer individual units, et cetera. So examining the mismatch between those needs and what the shelters have will be really important. And then one of the last things that came up was the need for a 24/7 shelter. Right now, the current shelter is open, I want to say from 7 a.m. to 5:30 p.m. And people prefer to have a 24/7 shelter so that they can be housed throughout the day. And
Really, shelters open until 6 p.m. and 7 a.m.
okay, thank you. So that was those were the recommendations for the services and shelters. For both shelters and services, people discussed that there was a lack of coordinated approaches across systems. So developing some kind of like referral system and having more coordination across systems might help a person who would otherwise be, shuffled between place to place. It would be easier for them to have like one location to get everything that they need. And then when it came to rehabilitation systems like hospitals and jails, people mentioned that there could be a boosted referral system there so that when people exit, they are properly connected to the resources they need. Other things that were discussed were transportation needs, just needing more transportation system in general to get either between services and shelters or to a potential job. People discussed that there is a negative stigma within the community toward people who are experiencing homelessness, and that can sort of get in the way of finding solutions. And it can influence how people interact with homeless people, or who they call when there's like an emergency. So that came up. And then the last bit of information that came out of our engagement was concerns about just data collection for measuring homelessness. At the moment, the PIT, point in time data that we have, is an undercount. And some people mentioned that had something to do with staffing capacity and maybe some coordination. And then there's also just something that I think all jurisdictions struggle with, and that's just counting people who are doubled up or, living with someone, but technically they don't have their own home or they aren't renting a place. So that's,
I have a couple questions for you on this slide, if you don't mind.
Mhm.
First off, where did you get the data from that you drew the challenges and barriers from? Was it from interviewing individual people that were on house, or interviewing people interviewing the shelter staff? Or where did you met as an interview folks, where did that come from?
Yeah, so our engagement included people on the homeless advisory committee. It included service providers, And then some of those service providers also had lived experience of being homeless. And then other folks who work in the public space who would be interacting with homelessness. Is there anything to add onto that, Madeline?
Yeah, I believe in the end, we talked to one person who had lived experience with homelessness, but it was a joint decision made with Nick and us that connecting with the service providers was a good enough proxy for understanding the needs of the community, because those service providers were in the community every day doing this outreach and understanding kind of the pinch points and leverage points in the system. And like, I think we asked a lot of people, like, if you could wave a wand and have a policy change or have something in the system change, what would it be, to kind of try to highlight those systemic opportunities. We didn't end up traveling down to Madras, so we didn't think that conducting virtual engagement with people experiencing homelessness was going to be very fruitful. So we ended up, like I said, speaking with one person who had lived experience, and then the rest of our engagement was with the service and public sector staff that interact with the community. All in all, we did 8 interviews and had one focus group with an additional 3 people.
Okay, that's not very expensive to all of a sudden be policy change, so we'll work that through.
Well,
My fear is that we'll make policy changes based on 11 people.
one, we had limited budget.
Right.
2, I made the decision to not interview homeless people in our community because I thought our service providers would better reflect and understand their needs based on Eco Northwest. In other words, when I talked with Lori during the camp, I don't think she's gonna be able to articulate what exactly her needs are for purposes of this report. Now, if they were to talk to a public health official, that public health official is more likely gonna be able to say, well, we're experiencing this. And we're seeing people are needing this, and this is the cause of that, or whatever. And so that was the method.
Mike? You didn't do public health?
They didn't interview myself,
I don't
but
know.
I mean, I have a lot of insight with.
Yeah, it would have been great if they would have interviewed you.
We tried having that time where we invited them to come tell us what their needs were at the shelter, and that was less than fruitful.
Yeah.
We were all there.
No, I get that.
And I do know that they did interview myself, Heather Pro Martinez, Michelle Elliott, who was the alcohol and drug and burn director by Zoom meeting. So we interviewed for about an hour.
Okay.
Lots of questions.
I guess my question for Mayor was, would you like to pause this so we can go out and do more interviews?
I don't know, yes, it would make a difference, we haven't hit the recommendations yet. So if all of a sudden they're dramatically different than the path we're taking, then we need to evaluate, it. But if it turns out that there's some slight tweaks, I'm okay with it. But if we're all of a sudden taking a 180 change, that's gonna be a different conversation, in my opinion.
Okay.
I'll just add, we did talk to someone from Jefferson County Public Health. So we had, and I think several of the other folks, like you mentioned, we interviewed Best Care. And we also had, you're right, we haven't gotten to the recommendations yet. These comments on challenges and barriers are also from the interviews, but also from our review of research in what works, both the published literature on potential solutions and the most effective interventions, but also our knowledge about what works in other communities elsewhere. So we're trying to do a broad approach about what is the existing situation on the ground for the point in time and the demographics of the community experiencing homelessness, and looking at the research literature about what is determined to be the most effective solutions. Then we go talk to your community and say, what's working here, what's not working here, where are the pinch points, where are the bottlenecks? And then, so we came up with a list of 10 recommendations, and actually, Nick, if you want to advance the slide to slide 9, This is the preliminary list of potential actions that we would recommend. But in the packet, I believe the very last slide of the larger packet has we are going to be evaluating 10 actions in depth, but there is also a longer list that we intend to include in the report of other actions that would be worthy of consideration. So, or future evaluation. This is, as you would imagine, I know all you know, these 10 solutions on the slide are not the only solutions, but what we've determined to be the most appropriate, both for this research project, and I'll expand on that in just a second, but then also based on what we heard from the community directly. And on that note, we know that the Community Development Department is having a housing action plan conducted at this same time. And so recommendation number 1 on reducing inflows and increasing outflows is to expand the regulated affordable housing supply. And I'll note that we didn't include anything kind of farther upstream about the regular housing supply, like just in general, housing affordability, the stock of housing being rental or homeownership or multifamily or smaller or ADUs. We're not making recommendations on any of the general housing market changes or zoning or parking. We're not going there. We had to draw a line in the sand about what our study would be recommending, knowing that this larger housing action plan is forthcoming this fall. So I did want to mention that research has borne out time and time again that overall housing vacancy and overall housing costs are the preliminary driver of homelessness. It intersects with behavioral health and mental health challenges and personal circumstances to form a difficult situation for many. But in a world where there's ample, safe, affordable housing, you don't have homelessness in other parts of the country, for example. So I wanted to put that out there as kind of just the framework in which this study is operating and the starting place for where these recommendations are coming from. Any questions on that before I elaborate?
You were saying that other communities, like you said, if you implemented this, don't have homelessness. Do you know ones that don't have the issues?
That's not exactly what I said. More or less, there's been a lot of comparisons of the higher rates of homelessness along high cost, low vacancy housing markets, primarily along the coasts of the United States. And some studies have, or some even just news articles have compared and contrasted the communities along the coasts with communities in the middle of the country, particularly in Appalachia or in Texas, where people still struggle with personal circumstance challenges. They still struggle with mental health. They still struggle with opioid addiction and substance abuse. And yet, because housing is plentifully available and low cost, people are able to scrape themselves by and stay housed, even when they're facing personal circumstances and personal challenges. And so many studies have done statistical analyses that compare the rate of homelessness, not that any community has zero, but comparing the rate of homelessness in different housing markets and controlling for things like unemployment rate, controlling for weather, controlling for the rate of disability or the poverty rate, or even the share of renters, share of homeowners, share of people receiving SNAP, share of people receiving disability benefits, controlling for all those factors in a market, in a housing market. Those are not statistically significantly predictive of a higher rate of homelessness. The only variables that are kind of more causal or have a higher correlation are housing market factors like the cost of rent and the vacancy.
So I'm hearing, I agree that the cost of housing is a major factor in that, but we're hearing a lot of information about stuff that doesn't back by anything that we can see. Especially when we're talking about demographics that are vastly different from ours compared to others. I would feel more comfortable to see a graph or something that's actually backed by the data that we can compare and look in our eyes. It's because to me, that's evidence.
Is there a way, because like I was looking at the slides, it says like our homelessness population is 44, gone up to 50.
Yeah.
Is there a way to interview half of those people? Or some way to find out what their struggles are? If it's circumstance or whatever, or choice or any of that stuff?
Yes, there is. Requires more. Contract amendment. More work for them to do that,
Right,
but also from a professional perspective of content, I don't know that it would change the nature of this report. The underlying issues, whether it be addiction or economics,
right,
are two underlying factors. I don't know necessarily change this.
right, but like, what if only two of them are by circumstance and the rest are by choice, right? You know? And that,
And that's what I'm getting at by our demographics, is we have people here that have access to home.
Yeah.
And they choose to be where they're at.
right. Exactly, that's what I'm getting at. I mean, how, it'd be nice to kind of understand how much there is we can really solve with adjusting home prices, right? So helping, I don't know, I'm not saying downplaying, like helping two people is, don't do it because it's just two people. I'm just
Right.
curious to know how much of it is, the bigger problem is, you know, drugs and alcohol and everything else versus there's really just like, of the 50, two of them are like, I just can't afford a house. It's like, oh, it's two, maybe we can figure that out.
But a majority, a lot of, and one, I think we have higher than 50, and I think we all agree on that. And we saw what was it like before we got rid of Willow Creek in the wintertime. But majority of them, I would take housing if they could afford it. The problem is so many of them live on social security disability or SSI, which is $9.41 a month, and you can't find a rent. So if we could have more low income housing or affordable, we would have very homeless.
So what are those folks doing? The ones that can't, that need the 941? Are they actually living homeless or are they just?
Other ones, you know, there's 15 people to a 3-bedroom. Yeah, especially down a lot of the ones that they did have more housing. And even under some of our Hispanic populations. I mean, they live a lot of people to a house
Right,
because they don't have a place.
but how much of that is cultural? Versus they can't, like, is it, because I know a lot of guys like to do that, they like to move in together and pull their money and resources and. Because they make more money up here than they do down there, and then they send it down to help out the rest of them.
Right, a lot of that is Hispanic, not Native American. Native American, biggest ones that would like to find more affordable housing up here because of circumstances down there, as you know, it's most of the time pretty bad. And if they want to go smoking or drinking or their drug use, they sure can't do it in the environment they're crashing.
I like to find out.
So is it kind of sounds like it's like
Oh,
two things, like there's a homelessness crisis.
I wanna see what cities.
That's, you know, brought on by issues and circumstances, like they've gotten into bad habits.
yeah,
Drugs and all that things, there's that one, and then there's the housing. That if it was there, they could use it's happening. Right, got it, okay. Well, just curious.
Something more specific makes more sense to me. A lot of traffic things happening that.
So, Taylor, question for you.
Because there's so many people.
Of the 10 potential actions, it's hard for the city to do quite a few of these. Did you folks ever discuss ones that the city can actually do something with? Like, we can't increase tenant protections or maybe encourage roommate matching programs, but create a risk mitigation fund for landlords, we can't do that. So I'm just wondering if there's certain things in here that, because the homeless advisory committee is really championed by the city and then the other organizations supported. You know, we could certainly influence the shelter. It's a building we own, but we don't have the contract for the service portion of it. So just trying to figure out, does Eco Northwest understand the different relationships that exist within the city and where the influence versus direction can come from, as well as the who's kind of managing what? Because I think that would change some of the recommendations and actions.
Yeah, I'll address that. This is Madeline. Actually, I wanted to come back to the comment made earlier about the two different populations experiencing homelessness. And we definitely understand that there are some cultural differences between different community members and different people who have different experiences of homelessness as well. So when comments were made about there are places to go, and yet people might still choose or prefer to be out living in the situation that they're currently in. That is actually why half of our recommendations are aimed at meeting basic needs and assisting those who are experiencing homelessness while they are in this position, understanding that, and also along the lines of the fact that changes to the housing market writ large are a long time coming. That takes years, if not decades, to make a really big impact, and it's done one property development at a time. So when we wrote our scope with Nick, it was about reducing inflows into homelessness, meeting basic needs, and ameliorating the experience of homelessness while someone is in it, and then increasing successful exits from homelessness when people find themselves ready. So I did want to just address that, in that there are different experiences and different levels of readiness for people to move back inside. And there are, we've identified some ideas that the city and its partners can undertake to help people before they're ready, or until they're ready, help them get ready. So to your other question though, Nick, if you want to advance to the next slide 10, we've provided an example action sheet where we want to evaluate the 10. Once we get the correct list of 10, we would be evaluating these potential actions in the recommendations report with information like this. So on the slide and in your packet, you can see we would include, and this is something we want your feedback on. We would include a description of the action and how it works, not only how it works, but also why it helps to solve a problem. The action category could be a policy, it could be a program, or it could be a development. Those are kind of the three categories that second box offers. And then importantly, the next box, kind of second in the middle, is the city's role. So what would the city be doing here? And sometimes it would be passing a policy, sometimes it would be support, political will, encouragement, or funding. Sometimes it's just partnering and supporting. We've identified the population served, and then in the next box over the potential partners who would take a lead role in this action. So to answer your question, our aim is to definitely support the city and support you all in terms of what actions you think are appropriate to include in this recommendations report, and then also how they would be evaluated. How would the city encourage this action, knowing that it only has so much control, not only over funding and policies and free will of the individuals who are experiencing homelessness, just like it only has so much control over the housing market. And cities don't build housing, they enable housing to be built. So that's kind of the angle that we're coming from. We have this box that lists the desired outcome. So this is kind of the problem, the nexus to the problem that is trying to be solved. And we would want to include something about funding, either the source or a number of dollar signs. I don't think most of these policies, especially if they're, most of these recommendations, especially if they are policies, we can't really attach a dollar number to it, but we definitely want to include some information in here about how this action would be funded. And then the larger boxes at in the middle and the bottom are the considerations that would need to be explored about each of the actions and potentially some implementation steps. So our biggest questions to you as you look at slides 9 and 10, I don't know what number they are in the packet, my apologies, but our questions are these the right actions to be included? And are these the right criteria to evaluate each action in our larger report?
She's asking, are these the right ones for the folks?
Yeah, potential actions, the 10 that you provided.
Is that what you're asking? Is We're asking the group about the 10 and. Or are you asking us to take a look at the slides that, previously on the screen?
Both. Are these the right 10 actions that you think would move the city in the right direction and move and help ameliorate the situation on homelessness, either to reduce inflows, increase exits, or make life a little bit easier for those who are experiencing homelessness while they're in it? And then if these are the 10 that we would be evaluating in our report, on the next page, the action sheet, are those the right metrics of evaluation that you would want us to study? And I understand this might be a lot for a live discussion, so we'd be happy to take feedback through Nick or in writing or another way.
Well, going back on that slide before, things that we talked about before was, as Jeff Hurd brought up, there was that group that they make their choice of where they want to be at because that's their choice they want to make at. But there's also that group that Cindy was alluding to, that we have a group that we don't see. Those that are couch surfing or whatever kind of, and those are the ones that we could provide. Those are the ones we probably could reach out to and provide services to, which does a less than 10 could be beneficial for them. But I'm not sure exactly how, a lot of it comes to where can we find funding for this sort of thing? Because when I'm looking at this, the next sheet, just for example, where it says just cause evictions, and there's gonna be legal representation for these people. Where does that come from? Who's gonna provide resources for that legal representation? That sort of thing, so.
And is city allowed to explore capping security deposit requirements, and how would you get landlords to agree to
Right,
that?
these are all resources that I don't know where we can find the funding for those resources.
It would appear that there's two different categories. I'm sorry for coming in late, folks. So you have,
Welcome, Tony.
better late than never, sort of missed once or twice a year, missed the meeting, request. It would look like the stuff on the left, 1 through 5 is really the tenant, the housing, focus issue. And then the 6 through the 10 are the ones that are focused on, services or solutions for the housing. So I think there's two different ways to look at this. Yeah. On number 6, for example, yeah, we could always look at expanding programming in the shelter, and we're looking to incrementally be able to do that. But I'm not sure when you're running, 55, 60% capacity at the shelter, why would you expand shelter capacity? It would seem sufficient for the ones that are taking advantage of it. So yeah, we could really look, the center really, like 7, is on the way at one point in its future to becoming some sort of a centralized navigation center that maybe includes day services. It's just kind of a forced march and such. So I think 7 is, at least in my mind, something that we see. Yeah, so to your point, I think we have to just look at them, this list a little bit more in detail, but I would really split it, because 1 through 5 actually is dealing with something else. The housing, stock, as I look at it, tenant sorts of assistance protection, and then maybe the 6 through 10 has to do with maybe the houseless, if I'm looking at this correctly.
No, I would.
Does that make sense?
Take on 1 through 5. Because that's a huge financial uptick and potentially a risk. But 6 through 10, maybe we can do that, because I think we need to focus on where the low-hanging fruit is.
Right.
Up there. So Tony's right. There are other people living homeless. I mean, Nick and I met probably 8 or 10 of them at 2 houses just last week. And they want to stay there. Yes, they enjoy their drug use and everything else. And so they just squatted at these individuals' houses. So I think if we move them on based upon the homeowner's request, then I think we may see an increase in people attending the shelter, which may then change the dynamic to Tony's point of saying, yeah, we could, but why are we putting all the effort into it if we're only half full? That makes
So it
sense.
does,
Yeah, our average is about 16 and 9. I ran the numbers this morning, so.
So yeah, it's only 55 to
But it
60,
does
so
open
why
that-
build more capacity?
on
Yeah.
on number 6, though, it does open, when Dr. Vicker and I were talking, the shelter is a beautiful building and it has quite a few things there, but it doesn't have the space that we were hoping it would have for breakout rooms, for counseling
Yeah.
and that kind of stuff. So I can
Right.
see where 6 would be beneficial if we could have those additions built up.
Right, not bed capacity at this
The
point, but
resource capacity.
modular or something where, you know, partners like Best Hair
Right.
or we can come in and plug and play on site. Yeah,
Right,
exactly. Exactly. And then, for example, number 9, we got a referral through COIC. And so my staff later this month and in the beginning of October, we're going to do a culturally responsive training. We're going to do 2 one-hour sessions to help improve our ability. They call it a culturally responsive training and it's focused on indigenous populations. So I feel like 9 is on the way. We're looking at that as an example of a training to begin to increase our capacity there. So yeah, some of these, they're not off base. I think it's a journey toward maybe 6 through 10, but I think we're beginning and we're on the journey, definitely.
I would like to know 10, what kind of transportation assistance we're talking about, since we do have a bus system here. In fact, we have a bus stop right in front of the shelter. So what additional transportation assistance are they thinking of?
I'm
and
happy.
I'm sorry, go ahead.
I said, I was wondering what, on number 10, what kind of transportation assistance you were talking about, since we do have a bus system that is free here, and we actually have a new bus stop right in front of the shelter. What specifically transportation assistance were you thinking? That's the news.
Thank you. We did hear about the bus, and I think it's a matter of frequency and also just gas assistance as well, just given the distances that people have to travel to get to services, especially if a service that's provided is down in Bend or in Redmond. It's just a cost. It's just a matter of the distance and the time and the cost of gas that it takes to get there. And then that's for folks. Cost of gas is for folks who have a car. You know, I think that transportation in general in a more rural and spread out community is challenging. So for those who don't have a car or for whom gas is prohibitively expensive, it just becomes another burden. That's
Or to go grocery shop and if they don't have a car, or to go to the food pantry, or to go do their laundry somewhere and take it back, because all of that's pretty hard to walk.
I would agree with the gas assistance, and I've worked with agencies before that have done that. As far as bus frequency, that it would be a COIC issue. That wouldn't be something that we would necessarily be able to fix on our end, but it'd be something that we could talk to COIC about, but it's not something that we have to control.
We could talk with them, and at least find out where their routes are and what times they are and.
Mhm.
That's on their website.
Yeah,
already.
there's a couple of other, there's only one time slot between here and Warm Springs, for example, and I'm wondering if we can talk with Andrea. Because there's other times when they go to Safeway and it's like, well, you're on the way to Safeway, so can you make sure to add the shelters right there before Safeway? I'm assuming that's the way the route. So I'm wondering if we can talk, that's low hanging fruit to say, hey, Andrea, instead of just 10-19, you know, those other couple of route times, could you add just a stop at a shelter? Why they didn't except for one time a day, but that's something that we can do. Also, to let you know, there's no guarantees. We've got a grant in to start another program at one of our properties. And we're maybe looking at, could we have a vehicle that could be available to, you know, help transport shelter guests? Like they need to go over and talk with Trent and gang at Public Health or Cindy or whatever. So if we're able to be successful in this grant, plus I'm looking at shelter funding, could we have a vehicle in the shelter as well? We may actually be able to make a dent between those two things and maybe a bus service change in number 10. So, you know, some of these things are not really far off. What I'm hearing is it might be profitable for us to take the exercise of kind of putting it down in an action sheet. You know, so we're saying, okay, answer the inquiries as well as the categories in the example action sheet, so that it begins, you know what, there's a saying, what gets documented has a better possibility of getting done. Maybe we need to run the exercise of beginning to put the dream or the vision concretely into an action sheet, because we are thinking about really all 6 through 10. As I see that, that's good. I think it's online with some of the vision and the thinking that we have within the organization.
Other than number 8.
Oh, well, I think that's saying that there's a need to really look at funding. Yeah, and we have to be looking at it all the time, because we can't assume that the current funding is going to be there forever. So not a bad list is what I want to indicate, at least the 6 through 10. There may be some things that are very much achievable. And like I said, I'd have to leave the 1 through 5. That's not the purview of, yeah. And I'm hearing that's a different horse of a different color. So, yeah.
This is all really helpful feedback. One of our next steps is to be presenting to City Council, and we did hear your feedback on some of the existing condition slides, having some more information at hand, streamlining the years that we're comparing, add the years to the slide, and adding the sources. Certainly, we wouldn't want to take recommendations to council that are infeasible. So Nick, I'm going to think that we have a call later this week that we can talk about debriefing this presentation and then thinking about the next presentation. And our plan, there will be a full chapter in the report that is basically the list of action sheets. And so, Tony, I appreciate your suggestion that, you know, the words on slide 9 of the potential actions are shorthand, but, you know, increasing transportation assistance has a number of flavors. I actually recall hearing someone mention that the service provider staff cannot take a client in their own personal vehicle. So that might be alluding to what you're talking about needing a shelter vehicle that could then be used for quick and easy stopgap transit.
Yeah,
so
and we're working on that. Mm-hmm.
Yeah. And those are the types of nuances that we would put into the action sheet. We would provide considerations or explorations and link, you know, the shorthand of the title of the action to the problem that it's actually trying to solve, and how that would help either reducing inflows or increasing outflows, or simply making life a little bit easier for someone who's experiencing homelessness and who's not yet ready to transition into housing.
We have another question here from Stacy from Public Health.
So I just had a clarifying question. When doing these surveys, did you survey what resources are currently here with the local stakeholders, and then, like you were saying, regional stakeholders who already have programs that are running? And if there are ways to either build on the programs that are running, like you were saying, COAC, you know, adding that bus stop to alleviate some of the transportation, but also, you know, some of the create a centralized navigation center. My understanding was that was the dream of the shelter.
That's correct.
And then, so that would be, with that, what protocols are in place to move towards that? What, I'm not even gonna talk about aid, that's impossible. So unrestricted funds.
Yeah, that's very. Yeah, let me know if you find it.
But the curious about is if there was, or is there plans to evaluate our regional and local stakeholders and partners to see what programs are currently running, so we don't duplicate any services. Because resources are not plentiful here, so we need to make sure that it is done strategically.
Yes, thank you for that question. An assessment through our interviews and our focus group and our own research of the services and programming available to community members was one of our very first steps, so that we were understanding if and where if there were gaps in service provision, where might those gaps exist? And if there were either leverage points or pinch points or bottlenecks of where like an additional dollar or an additional staff person could be leveraged to unlock and help X amount more people. You know, we were trying to identify, I'm not trying to use jargon, but like literally the bottlenecks in the system or the areas at which one small change can unlock other positive changes and like make the system more effective and efficient. So yes, we certainly did. I believe our recommendations report will have a chapter, or in our existing conditions chapter, we would have a list of the services and programming already available, and the network of service providers and nonprofits, and where the school system plugs in, and kind of like what is the existing state of services, and what does this existing system look like? And then based on the interviews and, you know, our knowledge of what works elsewhere, we would say, what might an ideal system look like? What would the changes yield? And that's where the actions come from. So in the action sheet on that slide, we would definitely expand on potential partners. One idea we thought about having on like a little box we could have had in this draft is whether or not this is a new programmer policy or a revision or expansion to an existing programmer policy. And so that would be a really quick snapshot for you all to consider of like, where is, you know, are we creating anything from scratch, or are we really just expanding and revising something that's already on the ground?
And I think more specifically, my question would be, when we are, you know, talking about regional partners, those CBOs, are we asking what percentage of this funding or time services specifically went to Jefferson County or City of Madras, like within the county limits, or how many people came to their office outside of this area?
Unfortunately, I don't think we have data on that. We weren't able to ask service providers to provide us, you know, a percentage breakdown. I think that people can ballpark that, but we didn't have, you know, very specific data requests. So we can allude to that where we have the information. Again, it's just from interviews and conversations, not hard data. But I think it's worth mentioning that, and this might have been said at our presentation back in June, but the idea of these action sheets and the idea that this is a recommendations report and not an action plan was to offer ideas and potential recommendations with a little bit of evaluation and a little bit of criteria to city council that then, and Nick, you said this very much more succinctly than I did the other day, but that city council could then direct staff to take action number 2, 5, and 7 and move them forward, or take all the actions except for item number 4 and develop a plan. And so it's the action plan, the action sheets are an easy way to standardize and compare the different solutions so that city council could then direct staff to put them into a plan as almost a step 2. So I just wanted to mention that the evaluation that we would do is, it may prompt more questions than it answers, but that is somewhat by design, in that these are early considerations and potential implementation steps that you could do now, understanding that more evaluation needs to be done in the future to actually stand up a new program or actually implement a new policy, if you understand what I'm trying to say. Well, and I see I want to be respectful of time. I see we're a little bit past. So Nick, I think that we've received a lot of great feedback, taking some good notes today. And we have a call on Thursday, either Wednesday or Thursday with you. So are there any other comments for Taylor and myself at this time?
Doesn't appear so.
Okay.
Thank you for joining us today. Appreciate you willing to take the feedback. I'll give you some more guidance during our call later this week.
Wonderful. Well, thank you all for your time and your attention on this today. We appreciate your guidance and feedback and input. And we know many of you also participated in the, engagement we did this summer, so we couldn't have done that without you. And so we are very, very helpful, appreciative.
Great. Thank you.
Thank
All
you.
right.
Thank you. Bye-bye.
Well, I like the increased tenant protection on page 12. We could find the funding to do that, some of our folks, but
Yeah,
it's like, where the-
I'm not sure of any cities that are taking.
They identified two,
bigger.
Portland, Seattle.
Well, that was.
Those are very different cities.
Oh, by far.
Just stating the obvious.
Yeah, that's bigger than.
I'm not saying that that's a, base going forward, but they have very different financial circumstances. And I would say need. I think, Mayor, I don't know if I need an answer today, but one of the things I'd like to clarify with Eco Northwest is we have a presentation scheduled for the city council with them. This is basically the same presentation, I think, on maybe it's the 24th. Is that presentation too premature? Would you like them to come back with some revisions, or would you like this committee to see some changes before it gets to city council?
I think so. Especially, I agree with Will when you're talking about the point in time because I'm looking at this as an anthropologist in a way, because when you're looking at things that occurred during those timeframes, the things that happened in 2018 were vastly different than what's going on between 19 and 20 and even now.
And then now, yeah.
Right, I mean, there's some very dramatic things that are going on throughout different time, and so it's. I would think those numbers would be very different in 2018 than they would be in 2019 and 20 than even now. So I'd rather like to see time frame put on those things. And I like to see what's happening like now, even closer to what's happening now, because what's going on in 2019, 20 don't interest me, because I'm hoping we're past that. But what's happening right now, makes sense, I understand what I'm trying to say.
But it's hard for them to get the data without.
No, I totally get that, but I agree when you're looking at the numbers, how high it is about the cost of getting, I completely agree with that. It's hard for people to get into it. There's no doubt about that.
Yeah, that's
But,
correct.
but I really want to see the time frame on there. And if we can get a shorter radius rather than this big of a radius of time.
Yeah.
It's much more foretelling to me. So, and I don't like discussions about studies without seeing the study. Because to me, that could be anybody skewing something, you know what I mean? That's another researcher,
Good at that.
that's another researcher pet peeve. If you're gonna talk to me about this kind of research data, show me the research data, because otherwise you're just telling me your opinions. So.
They're pretty close on population characteristics, growth and diversity.
Yeah.
That's like, it's big side of things.
When I look at the current houseless population that we're serving, I just kind of had an insight here. It's not because of the issues listed in 1 through 5.
I know, and that's what Jeff was pointing out.
That, does that make sense?
Right.
It's, I'd love to be able to say, but
No.
because there are some things, that all of us around this table know around housing and the need to, and Nick and Gaines working on it, but the current population of houseless folks we're serving, they didn't come from issues related to 1 to 5.
You're right, and that's what.
In my anecdotal opinion. Yeah, it didn't.
But you do have a population, those that you don't see there that are couch surfing, and those are the people that could benefit. So when we first put together, Dr. Baker and I were talking about, there's two different people that we have when you're talking about, the ones you can see and the ones you don't see.
Oh, yeah.
The ones you can see are the ones that Jeff talking about, the ones you don't see is what Cindy's talking about, those that are couch surfing, those are the people that might go to benefit. Right.
roommate.
And I agree with you, I like this on page 17, because from what I've seen of our guests that come and stay with us, it's about half native and half mostly white, maybe one or two Latinx, but otherwise it's basically 50-50.
So-
Surprised that I.
What would
We had one.
be interesting to know, so the ones you do see the homelessness. If somebody was to be able to actually talk to them and find out why they're homeless, right? Just ask them the question. It's like, I have this gut feeling that the ones like that are struggling with the drugs and everything else is because I think a big part of it is the mental care sucks in everywhere. I mean, that's just that, and that's just just not enough people, and
And drug and alcohol.
that's what I mean, like the help, the mental health, like helping somebody mentally, I
Right.
think it's just not there, and we all know it. The resources are limited, and I just wonder how much is, like, if that was a big push funding, which I know everybody's talked about it for years, we've talked
It's
about
not
it.
just the funding, but finding the manpower, so. this came
Exactly,
up-
the funding and the manpower.
Discussion at the League of Oregon Cities Conference in Clement Falls, and we were having this conversation. In fact, me and the council from Albany got pissed off because they're pushing all this money to create more positions, more education for those positions.
Right.
And the areas you're putting in is not gonna benefit us and
Right.
those other areas. And we were very vocal about that, by the way. But the point still came down to manpower to fill those positions. They're not there.
And that's the crappy thing, because I know from my own personal experience, like I had a situation a couple years ago. I went to get help, I couldn't get any. Thank God I had family, because that's what I had to lean on, to help me out. But there's people who don't have family and they have nothing, so then you resort to, well, you drug yourself.
Yeah.
That's how you take care of your head.
And I would say too, that every situation is different. There's not a blanket thing that says every homeless person's on drugs or alcohol. And one thing that I see a lot of it's generational.
Well, I was gonna mention that too. When they did interview me, I said, how much of this is they're living that way because that's what they were taught to do?
We have.
They're
people that
adults.
Say that they do.
Right. And they're comfortable with it, but I said the biggest thing is, has anybody ever asked them? What do they?
And the population demographics have substantively changed since our winter shelter would have started last November, leading into the shelter services program. I was taking data for the last couple of years, and I remember before I got here and started the job on September 1st of 20, I was told that the population was about 3/4 native, 75%, or you know, with just a kind of a swag. And so the next couple of years, the first couple when I was here, you know, from my intakes and such, I looked at it, that wasn't the case at all. It was like 43% Caucasian, 43% native, a smattering of whatever. And so it was this season beginning in November, that the population has switched over the demographics to what it is now, which is 3/4% Native Americans. And there's nothing that I want to say about this that is, pejorative, racially or culturally insensitive. But the challenges and barriers of working with that this population experience are completely different. And so we're looking to really get a grip on what's the need, there, because you have to have customers in order to be able to, work with folks to address the solutions and such. And so, yeah, all of this, to your earlier comments, and forgive me for popping out, Mayor, I think that's spot on. I think some of this might be reflecting older data when in fact we are currently serving a population of which the majority is composed demographically in a certain way. And so it totally changes what we need to do in addressing, challenges and barriers, if that makes sense. And we're still trying to get our arms around.
Yeah, I think.
Yeah.
Making sure that we capture everyone as much as possible for the intake forms. For HMIS, but for ourselves too, because on the intake forms, they self-identify both what their race is, also what gender they are, and other things as well, but that will help us really identify demographically who we're serving by race, by gender, by age, whatever. So we're really, it's a project that I've really been
Yeah.
digging into to really wrap our arms around.
I kind of wish the sheriff and the chief were here today because there's, you know, as of the beginning of this month, having a possession of usable drug is now back to being a crime. And what the state wanted is each county to also have something in play for some kind of treatment to also be offered during that kind of situation. We kind of want to know what our sheriff and chief have done, or if they know of anything that's being done in the county for that.
Yeah, good question. But one thing that I'd love to see us do is find 3 potential actions that we feel like we can really take on in 9 to 12 months that are meaningful, because I don't think, and to Tony's point, 1 through 5 are ones that we can really gravitate to and launch on, because there's so many pieces to it. And I know Portland and Seattle have done it, but they have resources beyond what we have the ability to do. So I'd rather, and I don't want to see this group get frustrated by taking on something that we know is going to be a huge hurdle when we take on, number 7, for example. Maybe that's an easier one to work on.
Yes.
And so that might be one that we will take a look at, because we have an additional code enforcement person starting at the end of the month that is going to work on the homes where the homeless have just squatted. And so,
There are quite a few.
I'd like to see if we can find some more grant funding to do number 6.
yeah,
Not to build the size of the
Right.
bedrooms, but to add those modules for.
right,
Yeah.
counseling. and
Yeah.
negotiating.
If you were to ask me just a real quick and dirty to get your, because you're getting practical, Will, I would say maybe the second half of 6 as it relates to programming, there's definitely some things that you can bolt on. I would say the second half of 7, the day shelter, we've got something that can navigate over time, excuse the pun, to a navigation center. It's really maybe the day shelter in the next, if you say 6 to 12 months, could we work on that? I think 9 is a low hanging fruit, that's really getting into some training and some interactions to make sure that we've got the proper perspective and the understandings around working with, from a culturally competent point of view, the population that we have. And maybe, 10, if we get lucky on the grant, or maybe I'm looking at possibly a budget modification. Maybe we'll be into 10 just as a matter of course. So there's some things, maybe those meeting basic needs could be restricted a skosh. But I think there's some actionable things. Jean, would you agree with that? Within that. So if that helps, because if 1 to 5 seems like, oh, I don't know if we can do anything as well with that. But I think there are things within 6 to 10 that you can take a look at.
We're not only looking at maybe the cost of vehicle, we may be looking at additional staffing, especially when it comes to shelter and things like that. So
Right.
those are some things that, not that they're insurmountable, just some things that keep in the back of our minds for what we.
So
for the plan.
if we do these things, what do we expect the results to be?
Well, see,
How do we
that,
gauge it?
that's the X factor to me. I'd have to think further with that. That would be providing some additional services, but I'm really looking at what's gonna result. Because what we really need to be starting to focus on is things that are gonna move people down the continuum. Yeah, really. I mean, the things we're doing is great to provide stability under the feet of the population, but that's not moving people out of.
Well, that's what I'm saying.
Yeah.
Things will get, out of the 52 of them, not be.
I can't say with like things in 6
Yeah.
and 7 and 10, for example, 9, no. I mean, they may be helpful in serving the population, but this is a good catch. What's gonna be the outcome to making a dent in homelessness? I'm not seeing that right now.
Change too. especially in, the outlier, folks that are squatters right now. Shelter, that's gonna change the dynamic of the shelter, and that may help, to your point, Jeff, to find what it is that we're trying to create.
Well, yeah, that's why I keep coming back to, we gotta talk to them, ask them,
Maybe they
what
start.
do you need to not be homeless?
So their answer is gonna be housing that they can afford. Just-
Well, it's even below. It's even below low income, if that makes sense. This population has 0 to, they're even extremely lower. Yeah, yes. Thank you.
Why is it that they're low income? Why do they need it?
In some cases, they don't even have basic identifications, so they can't even sign up.
That's,
Okay, then is it a issue? Okay, so it's rental history. It's, we don't make enough money, right? So, and they need help with those things. That's what I'm saying. It's like, we need to identify the bottom of the barrel of what needs to be done.
Start working.
To get working with them, to help them, give them an opportunity to be able to. Maybe, because maybe, you know, providing housing at $200 a month, that's just not realistic. Right?
Exactly.
So how do we get them to come up to where housing at $800 a month is fixed?
and to be honest with you, there's, how do I say this? There has to be a willingness to make a shift in the lifestyle from the. Yeah, you can't help people that fundamentally haven't even gotten the fire in the belly to live or move in a different direction. And so there's a certain dynamic that I'm seeing there to say, okay, how do we really come alongside and help facilitate that?
See, to.
Mhm, mhm.
But. Others are actually actively, so.
And so why is not? That's the thing, it's like, folks like coming down and be like, what's the holdup? Why do you not want to pursue it? What's holding you back from wanting to do this?
Well, to the barrier of the 20 address, like the identification.
Right.
Number two, it's the lifestyle that they know, or like I said, a generational.
Right.
We have people who've been homeless their whole life. So if they're 60 years old and they've been homeless their whole life, it's gonna take more than just low income housing to motivate them.
Exactly. So, the program needs to be sitting down and identifying with folks. What do you need to be able to start with those programs? And maybe you can't solve them all, but you start somewhere, okay? And the easy ones. Yeah, exactly. Maybe.
That's what Best Care's drop-in center is supposed to be doing.
And the Methodist Church on Tuesday has the ability, I just.
Best care to go to the ready to rent.
Well, on the burn, I mean, are they, I know you guys were sick and it was closed for a while. Have you guys, is it people?
We sat down with Michelle today. That was only the last week and a half of the cooling center. Yeah, that we're clear. Pat said something to me that always arrested me, so I'm gonna channel her a bit. She mentioned to me over that you can't, Pat Abernathy, our shelter services coordinator.
Said arrest or interest.
It arrested me, sorry, when she said it. It just kind of stopped me in my tracks in terms. She said that the population, members of the population don't see homelessness in the same way we do. And so what she meant by that, and we've talked about this, is we look at it as, I'm just being very plain speaking, wow, this is off track of the mainstream population, the mainstream of how people live. And we're looking at it as, so that's how we kind of look at it. They look at it, she says, often she can't give you a percentage or a statistic. This is just the way we live.
Right.
So you see, does that? Yeah, so what do you do with that?
That's why we need to interview them.
Yeah.
Because for the report to council, council needs to hear. Because it opens up everybody's eyes. Because when I was interviewed, I said the same thing to the lady. I said, you've asked them, I said, because there are certain groups of people that, to them, they're living a normal life.
That's what I'm saying.
To them, it's the way it should be, and she's like, oh, I never thought about that, and it's like, well, yeah, so you have to think about it, so you gotta take it from, everybody has a different perspective, we all have a different opinion.
Mhm.
And who are we to say that our way is the right way?
Except for within a city, a way of living that's gonna be permissible. You can't live in Willow Creek and permit, you know what I mean?
Well, but Jeff, I would say, who's to say that isn't the right way? I think it's up to the city council to decide that.
Yeah, so,
Yeah, this is when somebody asked me as mayor about what right did I have to say this, that, whatever. I'm like, this is 1% of population that you're referring to. And I'm not responsible for just that percentage. I'm responsible for all things.
I understand. So, yeah, just, it's complicated, and I don't know if doing some of these things, boy, I'm not trying to speak of jaded or pessimistic thinking, but are some of these things really gonna turn the crank on an outcome that starts to move people out of homelessness? I just can't sit here right now and say that will help us care for this vulnerable population within our community.
It's not.
But is it going to put a dent in it? I just don't know.
Well, I think that's why, number one.
Yeah.
We need to prioritize some of the effort.
Yeah,
And then two, see how those efforts go, just like our housing action plan.
right.
There's many things in the housing action plan that we've done and frankly haven't been as effective as others.
And I
And
think,
when you update the plan, then you have more information, you adjust, right? And so the same thing my intention would be the same for this homelessness report.
and
Is
I
that
think
3 years from now, you look back and you go, oh, we did these 3 things. They worked or didn't work, and now we need, of a different circumstance, we need to adjust.
Yeah, it's called running the experiment. You know, scientific.
I'd like to see the changes on it again before it goes.
Yeah, I would agree. It's not informed to bring before it's the city council, in my humble opinion now. It's kind of, this is the first time we've gotten this up. Yeah, no, it's not prime time in my humble opinion.
I think one thing to remember too, and I love that statement, by the way, I didn't usually say that, but ultimately, as long as they follow the laws of our city, our county, our state, whatever, that these people, they're over 18, they're adults, and they have a right to live how they want to live. For as long as they're following the laws, then that's their decision, and that's whether we like it or not, or can see ourselves in it or not. Ultimately, it is their decision.
So
And
with that in mind, that's what I was saying, when Dr. Baker and I talked a lot about, seeing like. You have those who make the choice, that's how they wanna live, and as long as they don't infringe on the rights or comforts of other people.
Exactly.
And that is, and that's okay. But if we can provide this where people don't wanna live that way,
Yeah.
yes.
then that's what these resources are for.
Yeah, for example, some of these things, and I'm not saying that the city has the economic or whatever other wherewithal to take them on. But the precariously, the ones that are in and couch surfing, they're not homeless by a HUD definition, they're precariously out. So maybe some
Until
things
they're not.
within here,
Because
yes,
then there-
until they're not.
Because then there could be something like somebody kicks them out because, or they get whatever, I mean, there's always different things, and so the idea, I was thinking of this is. We don't have all the answers, but we have a multiple disciplinary group on this thing, so we can
Right.
at least pull those resources, or trying to track resources and try to point directions
Well,
to help.
we found out a week or two ago too, that if someone is living in a hotel that they're paying for, that was not subsidized, they're not homeless.
So telling them a night, go out and be in the car and homeless.
But the point is that there's all these
Right, oh, it's
definitions.
terrible.
Like when I worked at St. Vincent de Paul, we let people self-identify. Like if they live in the RV at BLM, they may not consider themselves homeless.
Right.
Because they have an RV, where other people living in an RV at their family's property may consider themselves homeless. So we let them self-identify. But as a HUD agency right now, we don't have that option. We go by that definitions. And that's when Tony found out that they could live in a hotel as long as they're paying for them themselves there.
I need to run because I got 3:30 in the office. When's our next meeting? If we're not gonna get updates of when the next meetings are.
What are you thinking?
Well,
Okay.
we have a staffing, I mean, Nick is down to a department of.
That and
I have a department of me because two of my people are out, three of my people are out.
Yeah, so.
so, I think our next meeting should be on October 14th unless. I don't know if they can make the changes we really want them to make. Even in a month, they can make some good progress on it, but our next meeting would be October 14th.
This is October 13th.
Okay, 2:05. Thank you.
Very bad chatting.
2 p.m. Yeah, I'll get to the jail.
Same back time, same back time.
Yeah.
Love that stuff.
But I agree with you.
Appreciate everybody's feedback.
Thank you.
Let's talk later about what we were talking about, and I'm talking about what's on the, trying to brainstorm some ideas.
No, so you're right.
Yeah.
Yeah. I see us bifurcated. One way to look at this is, are we looking at fair inflation as well as we can? Or are we looking to really make it good? And on how, because I think some.